This is the all fours posterior hip capsule stretch. So we're going to do you have a tighter hip left or right, or do you not know? Okay, that's fine. We're going to do this on the right side. So let's bring your knees together in this position. And by the way, all fours is hands and knees, so hands directly under shoulders, knees directly under hips. Good. And then I want you to step your right leg around your left leg. So you might need to actually scoot a little bit on the table to the right so that you have enough space. And then your right knee is going to come up and around over here. Perfect. Can we position you so that your body is nice and straight? So we might need to turn a little bit. That's okay. How's your right knee here? Okay. And then from this position, I want you to just sink, take a deep breath in. Exhale, sink back on that right knee and move this hip straight backwards. You should feel a stretch right here. Do you feel that? Yeah. Perfect. Take a breath in. Exhale, butt straight back to the wall behind you, trying to keep your pelvis nice and level. Perfect. Let's go one more. Breathe in. You should feel this right here. Exhale, push this straight back. And relax. Perfect. Good. So in this position, or with this activity, our goal is to stretch the back part of the hip capsule to better restore internal rotation, or pelvis moving over our hip, right? So if you're trying to do this and you're trying to turn into the right hip, in order to do that, you need to have mobility, or the ability for the hip to move backwards in the hip socket. And so what we're trying to go for in terms of what you're supposed to feel is not just a general glute stretch, but a very targeted where the head of the femur is right there. So kind of like the back pocket area of the hip. Once you find that, or the way that you're going to find that is by just shifting your hips straight backwards without turning them left or right. I guess it would be like this, or without shifting side to side. So once you're there, just go ahead and breathe. Every time you exhale, you can try and shift a little bit deeper into the hip stretch. And then as you breathe in, you just stay where you are for 4 to 5 deep, slow breaths. Good common practice in terms of breathing: 6-second exhales, 4-second pauses, and then a nice silent breath in through your nose. And one more thing in terms of this activity is definitely perform this on both sides, and also use it as a proxy in terms of determining whether or not you have asymmetries with your hip mobility. Most people tend to be a little bit tighter on the left side, but that doesn't mean that outliers exist, and you might feel a little bit more restriction on the right side depending on your previous injury history, or the way that you carry your body, your posture, etc. So play around with this. Make sure that you do this on both sides and that you assess. And if you need a little bit more love and attention towards one of your hips versus the other, by any means, don't feel like it's a bad thing to spend a little extra time on one side versus the other.